Welcome, everyone. My name is Dr. Lisa McCormick, and I'm the Associate Dean for Public Health Practice here at the UAB School of Public Health. I'm excited to welcome you to today's webinars, The Impact of COVID-19 on the Homeless Population. Today's webinar is made possible by the Office of Public Health Practice, MCH SAGE, and the Public Health Student Association. Please take some time to visit the OPHP website to see past seminars, and always check the MCH SAGE Engage page and the PHSA calendar for upcoming meetings and events. So let me welcome our speaker today. Ms. Carrie Leland is the Executive Director of Pathways. Carrie is a UAB alumni. She received her MPA, or Master's in Public Administration, at UAB, and has served as the Executive Director of Pathways, A Woman's Way Home, since 2018. Pathways is a United Way agency providing shelter and resources to women and children experiencing homelessness in the Birmingham, Alabama area. Pathways' mission is to empower women and children on their path out of homelessness through hospitality, housing, and hope. Carrie was awarded the School of Public Health's Lou Wooster Public Health Hero Award in 2019. And the School of Public Health has been working with Pathways since 2016 to provide health and public health education to Pathways clients. And we look forward to doing that with them once again, once we're past the pandemic. Welcome, Carrie. Thank you so much for being here with us today, the beginning of November, which is National Homelessness Awareness Month. So thank you, Carrie.
As Dr. McCormick mentioned, I am with Pathways, and I am the Executive Director there. Pathways is an agency that's been serving homeless women and children in Birmingham for over 30 years. And I will tell you more about our programming as we move through this presentation. But just to get you started, this is our mission. Pathways' mission is to empower women and children on their path out of homelessness through hospitality, housing, and hope. And our vision is a Birmingham free of homelessness. I want to talk to you about COVID-19 and the impacts that has on our work and the homeless population. But I want to start with talking to you about homelessness in our nation and locally within the Birmingham area. And so let's start with, how do we define homeless? And this is the population that Pathways serves, and this is also the population served by many of the homeless service providers in our area. So we define homelessness as the night before the person slept outside in a place not meant for human habitation. This would be an abandoned building or a place like a car, or in a shelter. So that is the population that we work with, and that is how we define homelessness. I would also like to point out that this is how HUD, the Department of Health and Human Services, the Department of Veterans Affairs also define homelessness in this way. The McKinney-Vento Act has a little broader definition of homelessness as it relates to children and those in school. But this definition of homelessness is used by us when we are determining who is eligible for our services, and most of the people in our area who are offering services to the homeless. I want to talk to you about the causes of homelessness. So what causes homelessness? A lack of affordable housing is the simplest answer. And so I want to start with that one first, because it really drives everything. More than at any other time in our nation, there is a lack of housing that low-income people can afford. And without housing options, people face instability. They face eviction when they cannot maintain their housing. Ultimately, they face homelessness. And I want to let you know that in our area and in the nation at large, The reason that people become homeless is because they cannot find housing that they can afford. I never miss an opportunity to talk about the need for affordable housing when I talk about homelessness, because that is one of the major contributing factors. The next thing is poverty, and this goes hand in hand with the lack of affordable housing, which is why I've listed it second. Low income households often do not earn enough money to pay for food, clothing, transportation, other necessities, and a place that they can call home. Job loss can send lower income households into homelessness. Poverty is one of those things that has been debated in many different ways using a lot of different language nationally. I am a proponent of a living wage personally, but I want to let you know that people who make a low fixed income, who earn a low fixed income, are people who make minimum wage, are definitely living in poverty, and they have a hard time sustaining housing. And so I think it's important that we look at the fact that housing prices rise around us when wages do not, and particularly when the minimum wage has not been raised in many years. And so that contributes to homelessness. And then there's health issues. Health and homelessness are linked. Health problems can cause a person's homelessness. The homelessness can contribute to a person's health. Being homeless can age a person by as much as 10 years. So we know that chronic homelessness or a long period of homelessness has negative health outcomes. Housing is key to addressing health needs, because people are healthier when they are housed. So again, back to my point that I started with affordable housing, because that really drives so many things. But housed people are typically healthier people. And so what we see is our homeless population have negative health outcomes, and they typically have more health conditions. The issues of mental health and substance abuse, of course, contribute to homelessness. That is one of the health issues that we deal with within our programs, significant mental illness, and I'll tell you more about that as we go through this. And then there's domestic violence. Many survivors of domestic violence become homeless when they are leaving an abusive relationship. I worked in the field of domestic violence for many years. We did a survey and found out that just less than half of the women who access our services in 2019 were fleeing or experiencing domestic violence. I cannot underscore to you the role that domestic violence plays in women's homelessness. I always think that it is worth mentioning. And then systemic inequality contributes to homelessness. People of color experience homelessness at higher rates than their white counterparts. There are reasons that we should be talking about nationally as to why this is. I think it is unacceptable. I think that we need to look at the underlying factors that are contributing to the homelessness of people of color. And so systemic inequality is on this list because it is a cause of homelessness. That is how many people, according to a 2019 count that we did, are homeless in America. And so what you see there reflected is 17 out of every 10,000 people in the United States. Now I want to tell you how we got to this number. Once a year, a count is held nationally and here in Birmingham to count the number of people experiencing homelessness on that particular day. It is called the point in time count, and it is a census of the homeless population. We do this every year, and it's been going on since about 2006 or 7, I want to say. So we've been doing it for a while. The count provides important information about demographics, needs of the homeless population, and how communities work to end homelessness. So that number, as I have noted at the bottom, represents 17 out of every 10,000 people. And so what this means is on that single night in January, when HUD conducted the annual point in time count, there were 567,715 people who slept outside, who slept in an emergency shelter, or who slept in a place not meant for human habitation. They are associated with every region of the country, family makeups of all types, genders, and racial and ethnic groups. So this is representative of a diverse section of the homeless population. 70% of people who experience homelessness nationally are individuals who are living on their own, are in the company of other adults, and about 33% are families with children. Far too many people in America sleep outside, and that's just the sad reality for our country. Among individuals, people by themselves who are experiencing homelessness, the numbers are more dire. 1 in 2 of individuals are unsheltered, meaning they are sleeping outside. So I've always said that it is inhumane, in my opinion, to sleep outside. I wish we lived in an America where no one slept outside. And I think as a country, we have to decide how we feel about so many people being homeless, so many people not having access to housing. I like to talk about this number because it's staggering, and it is absolutely what is happening around us in this country. Most minority groups in the United States experience homelessness at higher rates than whites, and therefore they make up a disproportionate share of the homeless population. We need, as I mentioned earlier, to address the underlying reasons of why. Systemic poverty plays into it. We often see that there's a lack of generational wealth. We often see that homelessness itself can be generational. So when we have a people group who experience homelessness at a higher rate, their children go on to experience homelessness as adults. When we have a people group who are marginalized economically, who are marginalized, who can't access housing and face discrimination in that, and face discrimination across the board in many areas, that contributes to homelessness. And so we can never underlook the fact that there are contributing factors to so many people of color disproportionately experiencing homelessness. And now let's look at homelessness in Birmingham. And this is our numbers from the 2019 data that One Roof provides. And I'll tell you more about One Roof in a minute. 981. So 981 people were experiencing homelessness in Birmingham when we did the count. 981 people in the Birmingham area were sleeping outside in a place not meant for human habitation or in a shelter. That number is higher from 901 the previous year. And you may say, why the increase? That's about a 9% increase. So why the increase? We had less shelter beds in 2019 than we did in 2018. We had less affordable housing in our area than we did in 2018. And I can tell you from working with people every day who are experiencing homelessness through our programs, it is becoming increasingly difficult for us to identify safe and affordable housing for our population. And that is a tragedy, because when we, as homeless service providers, cannot move people to safe and affordable housing, and when there's a lack of those units, we have a difficult time ending the family's homelessness, even if every other factor has worked out. So maybe we've overcome some other barriers that are contributing to the homelessness of the family. But when we don't have a place to put families that they can sustain and maintain, they're going to fall back into homelessness, or we're not going to be able to end it. And so I am passionate about us having more units of safe and affordable housing in the Birmingham metro area so that we can get this 981 number down. And one of the ways we're going to get that number down is we're going to have serious conversations about how to establish truly affordable housing in our area for people who live on low fixed incomes, people who do not earn a living wage, and even those who earn no wage. I can tell you that homeless service providers do not have enough resources to fully meet the needs of everyone experiencing homelessness, and that also contributes to the number. I always think within our industry it's helpful for us to examine the difficult decisions that we have to make. And one of the most difficult decisions that I have to make is how to allot the funds that I have that are limited to serve the population. It's not all bad news. There are some solutions to homelessness. And one of those solutions to homelessness is a coordinated approach. A coordinated approach means that the community looks at homelessness as a collective issue that we all, well, as an issue that we all work toward collectively. We go from looking at our individual programs to looking at how we can work together to create a strategic response that is driven by data. It's really important that our numbers be driven by data. It's really important that communities work together to address the social issue of homelessness. And so when we have a coordinated approach and we don't look at pathways as an individual program, but we look at pathways as part of a continuum of care. When we look at a program like Pathways and other homeless service providers in the Birmingham metro area as partners in helping this population and not competitors in helping the homeless population, what we do is we can make informed decisions on how to allocate our resources, how not to duplicate services and programs, and how to make sure that we are getting people into beds collectively. And I always say the coordinated approach is the key to it. There's no reason for me to keep a waiting list if there are beds somewhere else. People need to sleep inside at night. And I believe that with everything in me. And so every decision that I make about our program and our services and how to work with other agencies is not necessarily so that we will be the best and the brightest and always have the most clients, but that no one sleeps outside at night. So when you really believe that people don't deserve to sleep outside at night, you are in touch with other programs. You refer people to beds that they may have that are available. And it's important that we talk to each other about available beds. And we do. We do talk to each other. We call each other frequently about who has openings and is this client more appropriate for your program. And so I can tell you that the coordinated approach in Birmingham is a real thing and it happens. And we absolutely subscribe to the coordinated approach, and Pathways does, because I'm so passionate about it, and the staff understands that, and they are passionate about it. And then the solution for homelessness is housing. To end homelessness, housing is the solution. We have some programs called Rapid Rehousing in our area. And this is a program that is an intervention that is designed to quickly connect people to housing and services. A funding priority of HUD, or an approach that HUD has, is called Housing First, and that is where we house the homeless person first and as quickly as possible, and then work with them through the issues. And rapid rehousing is one of the tools in that. Housing is absolutely the solution to homelessness. And there are many different housing programs, and I can tell you that I'm a fan of them all because there are different types of housing needed for different individuals experiencing homelessness. People's situation is unique, and so I am a proponent of having multiple housing programs to meet those needs. One of the solutions for homelessness is assistance for the most vulnerable. Pathways has a program for one of the most vulnerable populations. And when we get to the part where I talk about our programs, I'll tell you about that. But some people need longer term rental assistance. They need supportive services to achieve stability. Permanent supportive housing has been a proven solution to help the homeless population that is the most vulnerable. And permanent supportive housing means that the person can be housed and they can receive supportive services while they are housed. And the person typically has a disability, physical or mental health, and the person can stay there for a long period of time while they receive intensive supportive services to transition back out into housing. And so, assistance for the most vulnerable, for those who are the hardest to shelter, for those who have the most needs, that's a highly skilled approach. It takes a lot of emphasis and expertise to do it, but it is worth doing because I believe that we have an obligation to make sure that the most vulnerable members of the homeless population are housed as successfully as possible. Another solution is a crisis response. A crisis response basically means outreach workers, coordinated entry into programs. So if the person is more appropriate for pathways, the outreach worker refers them to our program and we take them in quickly. It's also emergency shelters, a bed where if you're homeless today, you can sleep in it tonight. It's safe havens, which Pathways has a safe haven, and that's for the most vulnerable. And then homeless prevention. I have said when I've spoken other times to UAB and on the podcast I've done that it is less costly to prevent homelessness than it is to address homelessness once the person has become homeless. And so, homeless prevention is very important when we talk about crisis response. If we can help someone maintain the housing that they are in and help them from a limited amount of time until they can achieve some stability and self sufficiency again, that is worth doing versus letting the family fall into homelessness and then addressing it then. And then increasing employment and income. Programs are really important around increasing employment and income, and we do this at Pathways because really your income is critical to sustaining housing stability once we get you into housing. And so we have a focus on helping people increase their income. Sometimes this is through accessing mainstream benefits that they have not been able to access. Sometimes it's through employment or both. Vocational rehab is another thing that we work with, and then increasing access to educational and workforce development opportunities. I can tell you that all of these things that are solutions to homelessness that we do in the Birmingham area in our continuum of care that is led by One Roof. And the continuum of care is made up of many homeless service providers. We do different things. Some of us have programs that are situated to a subpopulation, or somebody may offer one particular program, somebody offers another. We have several agencies that have emergency shelter beds, and then we have agencies who have housing programs. But all of these things that are a solution to homelessness are going on in Birmingham and in the Birmingham metro area for our homeless population. And you have many agencies that make up the continuum of care that are working to continue to provide these solutions to homelessness and to expand the solutions to homelessness. These are our programs at Pathways. Our oldest program is the Day Center. And I love to talk about the Day Center because it was the first homeless service for women and children established in Birmingham. In the early 1980s, there were homeless services for men, but there were none for women. And so a group of people got together, a group of women, and decided that they would establish a safe daytime shelter for the homeless population that was increasing in Birmingham, and the homeless population of women and children that was increasing in the city. So the Day Center opened at the location where we still run the Day Center. It hasn't moved in all those years. And what we are is we are a daytime emergency shelter for people who live outside, for people who live in the places not meant for human habitation, like a car, an abandoned building. And we serve the sheltered populations that are coming to us from other emergency shelters. So some of those emergency shelters have nighttime programming, but not daytime programming. And so the women and children come to the day center during the day. So the day center is unique because it's serving not only the street homeless, but also the sheltered homeless. The day center provides lunch, showers, laundry, and what the clothing, hygiene products. One of the things that this is it's meeting the immediate and tangible needs of people who are homeless. And it's really important when we think about homelessness to think about the things that we take for granted. You can't do anything without an ID. You can't do anything without a place to get mail. You have to have an address. And so the day center literally serves as the address for many of the street homeless in Birmingham, many of the women who are living on the streets of Birmingham. We are their address where they get their mail. We are home. We are where they get a meal, where they get a shower, can wash their clothes, talk to a social worker, receive clothing, other personal care items that they need. So that is an important service to meet the immediate and basic needs of people every day. And the day center does that. We don't just meet the immediate and basic needs, but we look at the long-term needs of ending homelessness. And so because that, we offer the classes that Dr. McCormick mentioned. UAB is a community partner that was coming in prior to COVID doing classes. We had 17 other community partners that came in prior to COVID and did classes with our people. Those classes included classes on health topics, such as UAB did, and workforce development, literacy, life skills, support groups. We even have AA and NA in our day center. So there was just a large range of classes provided by 18 community partners. I do believe that it is important that we look at a holistic approach. So, not just what your body needs, what your physical needs are, whether it's a meal or a shower to get some clean new clothes, but what does your mind need? Because I don't want us to just think, let's feed you, let's get you a shower, let's get you a fresh shirt. I want us to do that, but I also want to say, let's invest in you. Let's ask how you're doing. Let's talk about the barriers that you are facing that are contributing to the homelessness. And so the classes are designed at Pathways Day Center, and there are about 32 classes a month offered through the Day Center, again, prior to COVID, and it will resume once we safely can do so. But those classes are all designed to address the barriers, to nourish the spirit, to elevate the mind, and also for us to learn from our clients what their needs are. Um, I always say, I'm not the expert in homelessness. A homeless person is the expert in homelessness. And so it is naive for us not to listen to our clientele who come through the day center and let them inform us of how best to meet their needs and how best to serve them. And then we have our program, Safe Haven. Safe Haven provides a residential home-like environment for women who have a diagnosis of a serious mental illness. They are among the most vulnerable of the homeless population, like I mentioned before. Some of our women who live in Safe Haven have been with us for years. The average stay of a Safe Haven resident is 2.5 years. For some, our health challenges can mean years and decades on the streets. And this is because they typically are the hardest to house and experience high instances of chronic homelessness. So Safe Haven has a intensive approach to case management and supportive services and medication management, life skills, job and education readiness classes. We do have women who transition out into their own apartments or housing. The unique thing about Safe Haven is there is no time limit on their stay. So, like I mentioned before, we have a resident who's been with us since we opened Safe Haven in 2006. She's still there. She still needs the program. And we have others who don't need us for as long, and the average stay is 2.5 years in our Safe Haven program. And then we have Stepping Stones. Stepping Stones is a program for women who come to us individually and for families. Stepping Stones has 24 beds available. It is a home-like environment. The whole point of the Safe Haven program is to build a case plan that address the barriers to stable housing. And again, we offer the life skills and the education and job readiness classes. But Safe Haven is unique in that the people who come to Safe Haven can stay there for up to 9 months. A lot of women coming to our Safe Haven program are coming to us from an emergency bed. An emergency bed is just that. It is a temporary bed. But sometimes the length of stay that you can stay in an emergency bed is like a couple of months. And some people are not ready to go into housing in, between 1 and 30 to 60 days. And so Stepping Stones is there providing a longer term stay for families that need more time and more intensive help to achieve housing. Safe Haven serves about 60 women and children a year. Safe Haven is important because, as I mentioned, about 33% of the homeless population is families. Homeless families are typically headed by a single woman with limited education who has young children. And I said that it's inhumane for people to sleep outside, and that goes for children. There should be no children who sleep outside. There should be no children who are born into homelessness, but that's just the way it is. And so Safe Haven serves families for a longer period of time. And that's a really important difference in our Stepping Stone serves families for a longer period of time. And that's a really important difference in our program is the length of time they're allowed to stay there. And then our newest program coming in 2021, it was delayed by COVID, is the Pathways Early Learning Center. And the need for the Pathways Early Learning Center to be developed is what's on the screen now. So the total population in Alabama, children under the age of 6, was 352,670. And out of that, 1 in 23 children in Alabama are experiencing homelessness. So 15,429 children under the age of 6 in our state experience homelessness. And we know that the largest concentration of homeless children in Alabama are in Jefferson County because we have the most homeless people in the state in Jefferson County, and particularly in the city of Birmingham is where most of those are. 97% of Alabama's homeless children are not being served by an early childhood education program. And so what we wanted to do at Pathways, because we serve so many children through the Day Center and through Stepping Stones, is look at how we could meet this need and close this gap of homeless children not being served by early childhood education programs. I want to talk to you about homelessness in young children. Homelessness is devastating regardless of age, but for children in particular, it can have serious physical, emotional, and psychological implications. Homelessness has a significant negative impact on the growth and development of young children. It forces them to grow up too soon. Oftentimes, they miss out on educational and recreational experiences that are enjoyed by children who are not homeless. And so we seek to establish our child care center that is exclusively for homeless children ages birth to 5 and focus on their immediate needs and be immediately available to them at no cost to the family. We believe that homeless children deserve a safe place to play, to learn, to be a child, and most importantly, to have a respite from the harsh realities of homelessness. We think an opportunity to learn and grow in a safe environment that is designed just for them will provide valuable foundations for their future, including their future schooling. And that's just what it'll do for the children. For the parents, access to childcare will empower them to begin their path out of homelessness. Without available childcare, many homeless parents who have children that are not school age take their children with them throughout the day. And this makes it difficult not having childcare. This makes it difficult for them to address the obstacles that are contributing to the family's homelessness. So, what the Early Learning Center will offer is a trauma informed approach to care, emergency child care, meaning that it is available from day one of homelessness. It's low barrier entry. Uh, we will have infant and early childhood mental health services, and then parent coaching and home visitation for the families that participate, with a strong emphasis on parent leadership. I think this is so important because sometimes I know that people judge homeless parents as not being good parents. And the reason they judge homeless parents as not being good parents is because what they perceive they cannot give to their children. There's a lot of reasons that I've already mentioned that contribute to a family's homelessness that are out of the control of the family sometimes. I've never met a homeless parent who doesn't want what's best for their children. Never. Um, Not in 20 years that I've been doing this. And so, parent leadership is an important aspect of this program because I know many homeless parents feel beat down, uh, overwhelmed, and they know that they are viewed by society as not, doing what is best or enough for their children. And I think building up the parent is not only good for the parent, but is good for the parent-child relationship and good for the family. So I wanted there to be a piece of this program that invests in the parents as strong and capable leaders of their families, because they are. I believe that they are. I believe that they love their children just as much as people who are housed. I believe that the stigma around homelessness is a negative one and an undeserved one. And so that's why parent leadership is part of this. And then, of course, a pre K classroom. That is very important so that homeless children can go into public school with a good foundation for future learning. One of the things I want to say about the Early Learning Center is it is a pilot project because it's exclusively for homeless children. So you may ask yourself, how are homeless children currently being served? Because we know that 3% of them are being served by early childhood education centers. We typically have a voucher system. So what that means is there might be slots for low-income children in daycares where children go who are also not homeless. And so we find that our children are competing for those slots with other children who may not be homeless, but may be low income and are absolutely deserving of those vouchers. We also find that homelessness itself and the transient nature of homelessness prevents our children from being able to access these services, because by the time their slot comes up, the family may have moved to another program, or they may not have minutes on their phone. I mean, there's just all kinds of reasons that they may not be available to make contact with by the time they get registered and their turn comes up. And so I really believe the way to close the gap is for a homeless service provider, Pathways being that provider, to provide an early learning center at the level where the family is receiving homeless services. And so it fits into what we already do because we have such a strong emphasis on children in our program. And it won't just serve the children that Pathways is serving. This is one of the first programs where the child is the primary client in the program. So the homeless status of the child is what makes them eligible for the Early Learning Center, not whether the parent is receiving services from Pathways. So we may have a child that is living at another shelter. We may have a child that is living with their father at another shelter that would normally interact with Pathways, but we will serve that child through the Early Learning Center. So it is not exclusively for clients served by Pathways and their children. It is truly for homeless children in Birmingham. And we expect to have about 25 slots and open in early 2021. And now I'll talk to you about the impacts of COVID-19 on the homeless population and our services. There was a podcast that I did that should be coming out next week, and I encourage you to listen to it as we talk more in depth on that podcast, specifically about COVID-19 and what we're seeing at Pathways and in the homeless population. But I want to let you know that COVID-19 is creating a new type of an emergency in our nation, and it's creating a new type of emergency in our area. To be homeless is a tragedy, but to be homeless and have COVID-19 is even more tragic. And so the compounding tragedies of homelessness and COVID-19 is something that worries me for our population. And the reason that it worries me is I had mentioned earlier that we know that homelessness itself can cause negative health outcomes. And so many of those who are experiencing homelessness have underlying health conditions that have worse outcomes when people get COVID-19. And so that has made me very concerned about the impact of COVID-19 on the people that we serve. According to an early estimate I was reading about from HUD, 400,000 new units of housing in our nation are needed to prevent the spread of the virus and care for the sick. These accommodations, housing again, would allow for social distancing, quarantine, and isolation for people who typically live in a crowded shelter or those who are living outside. People are healthier when they are housed. And I can tell you right now, it's very hard to run a congregate living shelter. Typically we want to get as many people in as we can. And so that's quite a crowd. And we're living in a time where we don't need to have such a big crowd because one positive case of COVID could turn into 25 positive cases of COVID within the shelter. And so we have had to reduce our population served in-house. So we cannot run either program at 100% capacity, any of our programs, because we need to allow room for social distancing. We need to allow for quarantine rooms. We need to focus on maintaining a healthy population because this is a population who would have significantly worse outcomes based on the underlying health conditions many of them have. And so it is against everything in my being to reduce any census that we have in the building because I am a fan of shelter and taking as many people in as we can. So I've had to pivot and I've had to look at this from a public health perspective and from a perspective of congregate living and how to do that safely. We can no longer have 80 people a day safely in our day center. We just don't have the room for it. And so we've had to adjust. We've had to cut out volunteers coming into our building. We've had to cut out community partners coming into our building. We've had to go to serving the street homeless only, and the sheltered homeless are staying at the shelters for daytime programming, but we're going to the shelters and delivering meals instead of the shelters sending people to us for meals. So we've gotten into this big delivery of services to prevent people from coming into our building and having so many people in the building. That's a very difficult thing to do for us economically. And the reason is because when we made the 2020 budget in 2019, we didn't know that COVID was coming and we would need all these extra things we had never needed before, masks and gloves and professional cleaning and twice the cleaning supplies and to hire a tutor to teach the children who are learning virtually. So I would say one of the impacts on us financially has been the added cost of service delivery that we didn't anticipate. There has been some funding to help us address the unique needs brought on by COVID, and I've been very thankful for that. We are having to look at utilizing hotel rooms for people who are sick so that they can isolate there, and then we take services there. And one of the things I want to talk to you about is the impact of winter coming and people coming in off the street who typically don't come in to us. Sometimes we see clients only in the winter months because they will come into a warming station, but they don't necessarily come in otherwise when the weather is mild. I think we're going to have to look at how we do warming stations. I can't have 20, 30 extra people in the building, probably only have about 5 safely to distance and make sure that the populations and the programs are not crossing, to really limit how much each individual program is interacting with each other. And so that's a challenge coming up that I'm going to have to think through. And it's something that's being discussed amongst the homeless service providers right now is how are we going to deal with the winter? The biggest impact COVID-19 will have on us at the local level is I think we're going to see an increase in the number of homeless people in our area. And this goes back to where I started, lack of affordable housing and poverty. We have people who were hanging on by a string. I had never met them. They were making it. They were barely making it, but they were. They may have been behind the bills, but they were able to catch them up and ultimately prevent evictions and things like that. Many people who are earning low wages, less than a livable wage, have jobs that they can't go back to. They are not able to work remotely. So they may have contracted COVID or lost their home. And people who are staying with family right now may not be able to stay with family in 6 months. And so I think that we're going to see, because the moratorium on evictions has lifted, I think that we're going to see people need our services more in the area of shelter, in the area of us helping with homeless prevention. And so I'm sad to say that the biggest impact will probably come in 2021 when people can no longer make it work, who are making it work perhaps right now, and they become homeless for the first time. And agencies like Pathways will be there to help them. We will be there to hopefully resolve their homelessness just as quickly as possible because I believe no person deserves to sleep outside. And so this is a way that you can stay connected with Pathways. We have several social media platforms where you can connect with us. And if anything I've said today has interested you and you want to become involved with us, you can email the volunteer at Pathways email address down at the bottom, and you'll be notified when our volunteer activities resume. And if you do that and you see me in the building, let me know that you were listening to this and that's how you got involved, and I will be happy to meet you. And I encourage you to partner with us in whatever way that you can, or find another agency of your choice and give back to your community with your time and your talents. And I hope you leave this feeling like that you know more about homelessness nationally and locally in the Birmingham area. And please go out there and be an ambassador for everybody to have a place to call home.
Well, thank you very much, Carrie. That was very informative and really answered a lot of the questions I had. But I do still have one about the point in time data from 2019, that showed us that over 500,000 people were found sleeping outside on a given night in 2019. I mean, that number could be grossly underestimated even before the pandemic, because of all the at-risk population, or even the people who just happened to be couch surfing that night, sleeping at a friend or a family member's house, but don't have stable housing for themselves. So are there other estimates for the number that might be not only experiencing homelessness, but at risk?
We do not have other estimates outside of that data, which we use for programming and funding and all that. It is higher, and there are estimates that it is higher because it is a one night count. So are you going to catch everybody in one night? No, you're not. We do track the number of people that we serve through our programs, and that we units of service and things like that. So our own internal data from units of service tell us that the number is higher locally. And so that gives us a snapshot, but it is not the complete picture. And I think it is people are underrepresented there because it is a point in time count.
Right. So another question was around this idea of the coordinated approach between all the different agencies that provide services to this population. I mean, even thinking about all the services that we have available in the Birmingham area, are there still gaps in services that for those that are experiencing homelessness in Birmingham?
One gap in service is because the early learning center is not open is childcare, affordable childcare. Childcare needs to be free to homeless families. I believe childcare needs to be free to low income families. But so that is a gap because we haven't filled it yet because the early learning center is yet to open. The biggest gap we have is safe, affordable housing for homeless families, and that is our largest gap. We have a lot of services around supportive services like food, and we don't have enough shelter beds. We lost some shelter beds between 2018 and 2019, yet the number of homeless people increased during that time period. So I would say some more emergency shelter beds are needed. Pathways actually expanded from 16 shelter beds in 2018 to 24 shelter beds in 2019 to try to meet that need. I know other agencies have looked at how they can add more beds, but at some point we just become limited by the physical building. You know, I can't build a wing on quickly to have more beds. That would take a capital campaign, and trust me, that is something that we've also talked about doing. But the biggest gap in services we have right now is people who are in shelter who are ready to transition to housing, and we can't transition them. And if we have nowhere to transition them and we have to keep them in shelter because there's no place for them to go, then we can't take the new people coming in who need to fill the bed. That's being filled by a family who we might could move out or an individual we might could move out. So I think there's an increased need for housing, whether that's increased permanent supportive housing, like our Safe Haven program, which has permanent supportive housing, or whether that's just traditional housing like an apartment or a place that's truly affordable for people who live on low monthly incomes.
So I just wanted to tell you, Dr. Irwin, I put in the Q&A to thank you so much, and thanks to all of your staff at Pathways for all that they're doing. Yeah, this is just a really important service for our community, and one that doesn't get as much notice, in my opinion. We did have another question about when you mentioned the different kind of classes that you were offering in the day center. During the pandemic, have you been able to keep up any of those life skill courses, or have y'all had to suspend it all?
Initially, we suspended it because we were just trying to get a grasp of the situation, figure out how many positives we had, both within our shelter population and staff, and how do we intake people. And that's been a whole topic I didn't even touch on, but I do more in the podcast. So I encourage you to listen to that because I get more into the nitty gritty of how we do things day to day. But we have resumed the classes for the people who are living in our building, and we are doing that with staff now instead of community partners. So it has been an additional thing that staff has taken on, and we're going to continue that until it's safe for us to fully open back up.
And then I think just one more thing. You mentioned ways that people can get involved with Pathways, but I wanted to mention to our students that are online today that we have had a number of students do internships at Pathways. We had one student that completed an Albert Schweitzer Fellowship at Pathways. And we've had a number of courses that had service learning as part of the class that have engaged with Pathways. So there are multiple opportunities through the school that you can get involved if this is an issue that's important to you, and you can reach out to the Office of Public Health Practice, and we can link you with Pathways and other organizations that serve those experiencing homelessness in our community if you would like to get engaged. Right now, Carrie, how many children do y'all have in the Stepping Stones program, and what are the age ranges for those children? And how do you, as we're approaching the holiday season, um, give these families a semblance of holiday and all of that? And is there things that people who are watching this might be able to do to help during this holiday season?
So all information about how to help us around Christmas will be posted on our Facebook page or on our website. So I would encourage you to follow there as we start talking about how to help us for the holidays. The youngest child we have right now is 1, and the oldest child we have right now is either 12 or 13. I can't remember if they've had a birthday yet, but so that's our age range. And we have several school-aged children. And like I mentioned, we've hired a tutor and have someone working to help them with the virtual school. So we have about 14 children in Safe Haven right now.
Well, Carrie, we really appreciate you being here with us, helping us kick out National Homelessness Awareness Month. And it's a joy to have you with us anytime, but we really appreciate it now during this strange time where we're having to do everything virtually. And we hope that you will come into the school when we can open our doors again, and we'll get more people together and bring some more awareness around this issue. So thank you so much for your time today.